Okay, let's begin with psychopharmacology. And of course, this is a section where I'm going to go over the antipsychotics, the antidepressants, the mood stabilizers, the benzos, as well as ECT. So let's begin with the antipsychotic medications. And as you can imagine, these of course are used to treat psychotic disorders. So these will be the treatment of choice for the schizophrenias, for the delusional disorders, patients who have major depression with psychoses, etc. They really do not know 100% how these drugs work. However, they do believe that they work by blocking the dopamine receptors, specifically D2 and D4. The newer medications also work on the 5-HT receptors. And what we found in the newer generation of medications is that not only did they treat positive symptoms, but they also treated the negative symptoms. So what you had were the patients who basically were still having the poor grooming, the social withdrawal, anhedonia, cognitive defects, as well as attention deficits. So you gave them the newer generation of medications, the one that affected serotonin, and lo and behold, these patients did get better. So always try to use the newer medications instead of the older medications. Now, not only do these medications affect dopamine and serotonin, but they also block alpha, so they produce hypotension. They also block histamine, so they produce sedation. And they also block muscarinic and nicotinic receptors, so you see a lot of the anticholinergic side effects: dry mouth, blurry vision, urinary retention, constipation, confusion. However, most of these side effects that I just mentioned tend to be seen more frequently with the older generation medications than with the newer generation of these medications. The way the antipsychotics work is that they selectively block specific parts of the dopamine tracts. For example, if you block the mesolimbic and mesocortical tract, what you do get is a reduction in psychotic symptoms. If you block the nigrostriatal tract, what you get is an increase in movement disorders. If you block the tuberoinfundibular tract, what you then get, of course, is an increase in prolactin with resultant galactorrhea, amenorrhea, and gynecomastia. Always remember that the other name for dopamine is a prolactin inhibiting factor. Now, the antipsychotics are going to be divided into three main groups. Those that purely block the D2 receptors, and these, of course, are going to be the older generation of antipsychotics. These are the typical antipsychotic medications, and they are going to be divided based on their potency. So they are either going to be the high potency antipsychotics or the lower potency antipsychotics. You then have a second group of medication which blocks D2, making it appear like an older drug, but it also blocks 5-HT, so it works like a newer drug. And risperidone is the only one in that group. So even though risperidone is officially a newer antipsychotic called the atypical antipsychotics, it still has side effect profiles very similar to the older antipsychotics as far as their movement side effects and as far as the problems with prolactin. And then you have a third class of antipsychotic, which basically works both on D4 and D2. So it works like the newer because it does affect D4, but it also works on 5-HT. And these include clozapine, olanzapine, quetiapine, ziprasidone, as well as aripiprazole. Now, looking at the older antipsychotics versus the newer antipsychotics, we know that the typical agents are the older ones. They mostly work on dopamine, specifically D2. They have numerous side effects, and they basically do very well on treating the positive symptoms. The newer drugs, the atypical agents, are the newer agents, of course. They work both on dopamine as well as serotonin. They have many less side effects, and of course, they treat both positive and negative symptoms. So as far as treatment is concerned, it is always recommended that you give patients atypical antipsychotics always as first line. You don't necessarily have to differentiate whether patients have positive or negative symptoms, but atypical antipsychotics should always be the treatment of choice.